You're listening to The Conversation Weekly from The Conversation.
You go to the grocery store and you're like, okay, this is real. I better wear my mask. I literally remember that moment. It was actually a wine store, but same thing. I saw somebody wearing a mask that I knew, and I thought, okay, this is real. I better wear a mask when I go out. That was very, very early.
This is Alex Bentley. He's an anthropologist and archaeologist at the University of Tennessee in the United States.
I work on a number of things, including data science, a field called computational social science and archaeology of mainly the Neolithic period, early farmers in Europe and in Southeast Asia.
The Neolithic period ran from about 10,000 to 2000 BC. This is the time when humans shifted from a nomadic hunter-gatherer lifestyle to settling in small tribes in one place, cultivating the land and domesticating animals. But our story today starts much more recently, in 2020.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
As COVID made its way through different parts of the world, Alex and some of his colleagues wanted to do what they could to help mitigate its spread. For him, this meant collaborating with an epidemiologist on a research project.
What was unique about our project was we were not just modeling the spread of disease in populations, but the feedback between social behaviors and the spread of disease. So are people wearing masks? Do people see other people wearing masks? Or do they see nobody wearing masks? And how can the disease respond to that? So our purpose was to look at how effective different measures of social distancing would be on the spread of the disease. And keep in mind, this is before the vaccine. So this was the one way of mitigating the spread of COVID.
It's been 5 years now since the first COVID lockdowns, and media organisations all over the world, including The Conversation, have been examining how the pandemic affected the way we live and work today. But this 21st century pandemic is also influencing the way we think about the past. In this week's episode, I talked to Alex Bentley about how the pandemic is changing our understanding of the way disease may have affected ancient civilisations, and the clues this offers about a sudden change in how humans lived 8,000 years ago. I'm Gemma Ware, and this is The Conversation Weekly, the world explained by experts. In the early days of COVID, public health officials were trying to flatten the curve. Assuming everyone would eventually get COVID, they wanted to slow its spread and prevent a dramatic peak in any single area. This would prevent healthcare resources from being overwhelmed and ensure care for everyone who needed it. It was at this moment that Alex and his colleagues were studying the virus's spread and the practice of wearing masks. And what they found was a feedback effect. People who lived in a place where everyone was wearing a mask were more likely to mask up themselves.
But if you're out somewhere where people are not worried about COVID or don't believe this advice, or, think it's a hoax or something, they don't see any masks when they go out. And that kind of confidence in not wearing a mask, not social distancing, can also spread. And the interesting thing is that almost the same epidemiological models can describe the spread of a behavior and the spread of a disease. And so we just simply coupled these two models and showed how it's kind of like a double whammy. Either you go towards very protective behaviors and the disease makes a decline, or the opposite.
Their study also explained why in some areas where people tended to follow masking and social distancing protocols, there was sometimes a sudden surge in the virus.
We also factored in the visibility of the disease itself. And this is kind of a classic epidemiological conundrum. If you're actually successful in this mitigation, the disease becomes less visible, people become less afraid or less vigilant, and then they get lax in their mask wearing or social distancing behavior, and then the disease can make a comeback. So we did actually extend our models to include the vigilance that people had by witnessing symptoms in other people, and we were able to show the conditions under which the disease might make one or multiple comebacks.
In late 2021, as the COVID vaccine became available, the threat of the pandemic receded, and Alex returned to his studies of Neolithic farm civilisations. But his research on the spread of disease and how it responds to different human behaviours was still fresh in his mind.
It was a perfect setup for looking at this same kind of question in the distant past when diseases were evolving for the first time in dense settlements.
This wasn't the first time Alex had thought about disease as a life-shaping event in Neolithic farming villages.
As an archaeologist, I've been thinking about this since the early 2000s, and I credit a Professor Ruth Mace of University College London for telling me.
We've had her on the podcast, actually.
Oh, you have? Okay.
Yeah. Ruth was actually on this podcast a few years back telling us about her research on celibacy in Tibetan culture. She's fantastic, and we do recommend you go listen to that episode. We'll put a link to it in our show notes.
So she's brilliant. She told me 20 years ago that disease was one of the most unresearched, underappreciated factors in the evolution of human behaviors. But the reason why archaeologists never considered it is because it was never visible until the revolution in ancient DNA that's occurred in the last 10, 15 years.
New technologies are now allowing archaeologists to analyse ancient DNA and identify viruses and bacteria in ancient fossils and artefacts.
Just in the last decade, there's been one paper after another identifying the origins of different diseases, mostly in Europe, through the ancient DNA analysis of pathogens and identifying Salmonella, maybe 5000 BC, identifying early versions of measles, tuberculosis, and so on, and also plague, including bubonic plague.
To understand what Alex and his colleagues did next, we need to travel back in time to Anatolia, now known as Turkey, to one of the world's earliest known farming villages called Çatalhöyük. Back around 7,500 BC, it was home to approximately 10,000 people. They grew wheat on the plains and raised domestic animals like sheep, goats and cattle. But this village had a very distinctive layout.
They're living all packed in mud brick houses that are so closely spaced that there's very little alleyways between them. And people actually had to access these houses through a ladder, through a trapdoor, in through the roof, into the space. And keep in mind, this is a wide open plain. It's a great mystery why people would live so closely to each other when they surely could have spread out. Lots of anthropologists would say it's actually very convenient for people to fulfill their obligations to one another and to cooperate and to do what humans are uniquely specialized at, which is to collectively raise their children. Living cheek by jowl is conducive to that. But it's also conducive to the spread of disease, especially when you're living so closely with animals.
Then, around a millennium later, at 6000 BC, Çatalhöyük was completely abandoned.
For whatever reason, at that time, 6000 BC, is the instigation of a dispersal of people, farmers, very rapidly into Central Europe. And what people do after they abandon this ancient village of Çatalhöyük is to start living in more dispersed settlements on the surrounding plain. Within about 500 years, there are small clustered settlements from Hungary into the Rhine River region of southwestern Germany. It's very rapid dispersal. And these people lived in timber, wattle and daub longhouses that were very well spaced. They had their own little plots of land for gardening. They may have pastured their animals up in the hills. They liked to live in these fertile soil plains of Central Europe. And they lived in little villages of, maybe 30 people, maybe more, clusters of little houses that were then separated from the next village in another river valley, for example.
Nobody knows why Çatalhöyük was suddenly and rapidly abandoned.
There are many theories for why it was abandoned, but I think one of them that we have to put into the mix is that the disease load just became unsustainable.
Remember, researchers have identified diseases in this area as far back as about 5000 BC, But because all the dates here are just approximations with large margins of error, it's possible that these diseases were present around the time Çatalhöyük was abandoned.
We don't have like a smoking gun. We don't have, some sample that shows the disease was the cause at Çatalhöyük. But the change in behavior into settlement spacing occurs after that abandonment. It just looks like an adaptation to a disease.
Then around 4,500 BC, that's about 1,500 years after Çatalhöyük was abandoned, anthropologists have found evidence of a new housing trend emerging in the western Black Sea region, what today would be Moldova, Ukraine and Romania.
When people do come back together in the region to live in settlements, the houses are now more spread out. They're not literally next to each other where they're sharing the same walls like at Çatalhöyük. They're now living in villages that have households that are well spaced. And these settlements, they were maybe 800 meters across or 1,000 meters across. And imagine 10,000 two-story wooden houses built on posts with thatched roofs and pottery. And the whole settlement is almost like a planned housing development that you would see today. So they're in a circle. The houses are arranged in concentric rings with spaces between the rings of houses. And then in the center is an open area that may have well been used for pasture land, literally a commons.
Archaeologists call these developments Tropilian megasettlements.
But here's the thing about the Tropilian settlements that's really remarkable, is they're carved up like a pie. You can imagine, let's say, 12 different pie-shaped segments of this circular development. And each one of those pie-shaped sections has within it what they call an assembly hall, but it's a very large structure. And inside some of those structures have been found the remains of pottery, these lovely stylized figurines of humans that have become kind of a symbol for Tropilian settlements, and pottery that has a varied composition that suggests that maybe people were actually bringing their own pottery to these assembly halls. I almost think of it as like a potluck.
Fresh off their COVID research, it made sense to Alex and his colleagues to consider what would happen if a contagious disease arrived in one of these segmented settlements.
We thought about this for decades, but everything lined up by 2022 when we started this project. And we said, we can model this.
They focused on a Tropilian settlement called Nebelevka, located in modern-day Ukraine. Using the same type of model they'd used to understand the spread of COVID and people wearing masks, Alex and his colleagues were able to map out how a contagious disease could have spread through Nebelevka.
And what we were looking to show is that whether people knew it or not, living in this more spread out fashion, this more clustered fashion, was actually a good adaptation to disease. It would have helped prevent the spread of disease in a social distancing kind of manner. And we positioned this model on the actual site plan of Nebelevka. And the main variable that was really important was we assumed that if somebody got sick in a household, then we assumed everybody got sick in the household. There was some transmission probability between households within the same neighborhood, these pie-shaped segments that I was mentioning, on the assumption that they would have met regularly at these assembly halls. So to keep it simple, we just pretended that it was foodborne, that they go to the assembly hall, they share food, and then there's a chance that everybody gets sick. Then there's another probability, and this was the key probability we were looking at, is what is the probability that I interact with the next neighborhood or with another neighborhood of this large settlement that's, a kilometer in radius. And when you're doing this kind of modeling, you're doing literally millions of simulations under different combinations of these probabilities. And so we zoomed in on what is the crucial combination of how infectious the disease was versus how likely is it that people are to visit another neighborhood that leads to a disease that spreads across the whole settlement. And so we found the kind of safe space of those combination of parameters, which is obviously, low infectiousness, low chance that I go to the next neighborhood, versus, the danger space, which could be people moving around between neighborhoods very often and or it's really infectious. The disease can spread within a cluster, but then may not make the jump to the next cluster. So it's unfortunate for those in the cluster, but the segmentation of the population helps prevent the spread of disease throughout the whole population. And we found that it was quite plausible, given the layout of Nebelevka, that they were actually more in the safe space region. In other words, if you had planned a settlement to be resistant against settlement-wide spread of disease, this would have been a pretty good plan.
This raises a big question, though. Given that people in 5000 BC didn't understand pathogens or contagion the way we do now, how can we assume that they could have designed their cities in this segmented fashion, specifically to avoid the spread of disease? But Alex argues that adaptive behaviours can be unconscious.
We can be sort of, semi-aware of the kind of adaptive behaviors that we engage in. Think about a situation where you look at something and you think, I don't want to go in there. And you haven't mapped it out. It's not something you planned that morning, but it's an adaptive behavior that you engage in and that makes you comfortable with your avoidance of whatever situation it is.
The layout of a city is no different.
The formation of cities is a slow process. It happens at the confluence of trade centers, and it builds up as specialists kind of live in one place and trade is bringing more people and products into one region. But if people are just dying from disease, then that never would have happened. So it doesn't have to be a forward planned thing. It's just something that if it didn't happen that way, if there wasn't some element of disease mitigation, then it couldn't have happened. That's the way I look at it.
And so these settlements were designed, as you say, you don't really know exactly why, but the way they were designed did help mitigate the spread of that disease across an entire settlement.
It did. And regardless of the intentionality of all this, archaeologists tend to reason why humans arrange themselves in a certain way because it was adaptive for this, it was adaptive for that. And we're saying that disease mitigation has to go on that list as a very prominent reason for these adaptations.
In fact, the people who lived in Trypillian settlements engaged in other behaviours that speak to their awareness of disease.
A majority of the houses at a settlement like Nebelivka, one of these Trypillian mega-settlements, were deliberately burned to the ground. And that's clear in the archaeological record. The archaeologists we work with can see the ash layer in the excavation. But also John Chapman and Biska Gedarska of Durham University have done experiments to see how hard it would be to burn down one of these houses. So they built one of these model houses, and they had to stack kindling next to it and get a really good blaze going to burn it down. So it was clearly deliberate. Now, why would they be burning down their houses after they'd used them?
Because it would cleanse the area from a disease, a pathogen, perhaps?
Yeah, and whether it was a tradition that then became really useful or something that humans have been aware of for quite some time. Again, it's another behavior that we're seeing, people spreading out, people living in clusters, people burning down their houses that we didn't see at Çatalhöyük. So it all kind of makes sense. This is obviously a big hypothesis for future research, but it all kind of makes sense if disease is a big part of the reason that people are making these decisions.
And then if you bring it all forward to like the moment we're living in now, this kind of post-pandemic moment, it's 5 years since COVID started. How does it make you think about, the direction of urban planning and urban density and the way people move through cities and what might change now?
Well, one of the things we learned was how complicated this kind of modeling is in the present. We considered several layers. There's what people are doing on the ground, what people are observing around them on the ground, and then there's the communication layer, what people are being told or what media they're consuming. That's really complex, so it's hard to predict exactly. We feel like we started something, a way of modeling this threefold layered process. But let me put it a different way. Look at how much of our behavior has changed as a result of COVID. We wouldn't be doing this interview the way we are. The whole pattern of work and life and residence has changed as a result of just one pandemic. It wasn't a minor pandemic. So just stepping back a little bit is the philosophy that, wow, disease epidemics don't just kind of reduce the population or have an impact on population numbers or survivorship. They can change the whole residential behavior patterns of a society. And so that would be the general message I would take away. In each case, from 4000 BC to now, this is what we see. Look at each one of these major disease epidemics and see how the behavior and economics change in their aftermath.
Great. Well, thank you so much for your time. It's been fascinating speaking with you. I really appreciate your insights. Thank you.
Thank you.
That's it for this week's episode. You can read an article that Alex Bentley wrote about his research with some great pictures and designs of what these ancient settlements would have looked like on The Conversation, and we'll put a link to that in our show notes. This episode was written and produced by Katie Flood, with production assistance from Mend Marawani and sound design by Eloise Stevens. Our theme music is by Nita Saul. Stephen Kahn is our global executive editor, and I'm Gemma Ware, the executive producer. You can email us directly at podcast@theconversation.com, and you can sign up for The Conversation's free daily newsletter too by clicking on the link in our show notes. The Conversation is a non-profit news platform dedicated to sharing the work of academic experts to help you make better decisions. If you like what we do, please support us at donate.theconversation.com. And please do also rate and review the podcast wherever you follow us. It really helps people to find us. Thanks for listening.